Dr. Nada, keyhole surgery, laparoscopic surgery, minimally invasive surgery, what are they?
So these are all terms referring to a certain way of doing an operation, whereby we introduce a small little camera into the tummy or chest to look at what's inside. And then with two or more tiny incision, we introduce instruments. So the hands of the surgeon extends into tiny instruments in the inside, and then the eyes of the surgeon is through the camera. And the camera projects the image onto a big screen where the surgeon is looking, and then he's using tiny instruments looking at the camera to do the operation. So essentially, you have tiny cuts to get access to the abdomen, and then we can see with real clarity what's happening inside. In fact, we're using 4K technology now, and we have very good visualization of what's happening inside to enable us to do the surgery. So instead of a big cut, to get access to the same area, we're making small little dots, doing the operation inside.
How common is pediatric keyhole surgery around the world, especially in advanced medical countries?
Keyhole surgery has been around for about 20 odd years around the world. So if you look at Europe, America, even Japan, Korea, keyhole surgery is the mainstay of surgical practice for children. And that is because that's the current best way of operating. And if you can offer pediatric keyhole surgery, that's the best way, because that involves very small cuts, quick recovery. And why would you want your child to have more pain and longer stay in hospital and longer recovery and scarring when you can do everything by keyhole method where they recover faster, minimal scarring? And it's available throughout the world, and in Malaysia, it's gaining reputation, gaining recognition. And the technology is available, and a lot of hospitals have the technology for keyhole surgery. It's just a matter of whether there's an available surgeon or pediatric surgeon to offer you that service. So the experience of the surgeon is very important. To do even the minor surgery like a hernia operation or appendectomy operation, you need experience. And the surgeon's experience is crucial to the success of the surgery and the recovery for your child.
Is keyhole surgery more expensive than open traditional surgery?
So if you look at surgery in Malaysia, keyhole surgery may be costing slightly more for the surgery per se. For example, I'll give you a figure of, let's say, 7,000 ringgit for a particular surgery done open, but keyhole surgery might cost 8,000 or 8,500 ringgit. But if you look at the overall cost, you're looking at a cost benefit which is equivalent. Let me explain that in further detail. For example, a child who's come for an operation, the cost for surgery may be so much. But if the recovery following keyhole surgery is so much faster, the days in hospital are much less. Which means that the days that they don't spend in hospital, the cost of that can be reflected as equivalent to surgery done by the open technique. Overall, the cost of surgical care for that admission is almost equivalent between keyhole surgery and open surgery.